fusion between the spinous processes. It's still called the medial sacral crest of liver. In other ones, there's more dorsal or posterior pelvic foramina. Those are the holes. And also ventral. See that? And then the intermediate, it's faint on this one. This is where the articular process is fused. The lateral sacral crest and the intermediate, so it's medial, intermediate, and lateral sacral crest. Lateral mass. Auricular surface, that's this. It looked like an oracle to somebody. You have to use your imagination, you know. Yeah. And that corresponds to the auricular surface on the os coxa, the hip bone. And it has a matching auricular surface for the SI joint, the sacroiliac joint. Now that brings up something. No abbreviations on the test.
Oh, well, gosh, no.
So no abbreviations in the test. You have to write things out. Now, anything abnormal about this?
No coccyx.
Well, the coccyx is separate.
It's
Look at that.
It's one side.
The S1 body is sloping obliquely.
Oh, I knew that.
It goes with scoliosis.
Me too, I just didn't
See,
Yeah,
in a normal sacrum, it would be either in a horizontal plane of section, you know, or extremely close to it. But here, it's substantially tilted. So that would mean abnormal lateral curvature. The spine was convex to the left in the lumbar region, and pronouncedly so, and convex to the right in the thoracic region. Okay, so that's scoliosis.
Can you go over the intermediate, lateral, and crest?
Yeah. The medial crest.
Mhm.
Now, the intermediate crest is very faint on this one. I can feel a bump over there. See where
Okay.
I'm touching?
Yeah.
That's part of the intermediate crest. It's very faint in this one. And then, but the lateral crest is more obvious. You see the bumps over there.
Yeah.
Can you show the right?
Yeah, so I can feel a bump right over there. See where I'm touching? That's part of the intermediate crest. In other words, the intermediate crest was not well developed. But it can be felt if not seen so much. But the lateral crest is more obvious.
So it's more medial to the
Yep,
foramen.
The intermediate crest is medial to the frame, and the lateral crest is lateral to the frame. Look at this. These are the bodies of the sacral vertebrae. You see they're not fused over there. So if you just had this, you have to know that it's important to know that in 90% of the population, this fuses at about age 25. But in about 10% of the population, the S1 and S2 bodies never fuse. So if you go with that data, you'd have to be able to say, if you were doing age diagnosis from just this one osteological element, that there would be a 90% chance that this individual was under 25, but a 10% chance the individual was over 25.
What was the name of the... What is that? What's the
Well,
name of
that's
that?
just a place where this is the S1 body, that's the S2 body.
Okay.
These are commonly called the transverse ridges when they appear.
Okay.
That's just a place. These are just the places where the body's fused.
Okay.
So that means the disc has to be reabsorbed, and then the body's fused. Okay.
Fuse in about 10% of the population?
About in 90% of the population, the S1 and the S2 bodies fuse ventrally over here at about age 25. In about 10% of the population, they never fuse. So that means if you only have this, what you'd have to be able, what you're going to have to say is, there's a 90% chance this individual, the individual from which this came, was under 25, but there is a 10% chance the individual was over 25.
Gotta get
And to
that
pin it
sacred.
down further than that, you'd have to look at other bones. You'd have to have more bones than that. But you can only go as far as the data permits. Okay, so that's as far as the data permits. All you have is this. This sharp concavity here suggests male. Okay.
This would just suggest a female.
Uh, This would point, this would be flatter here.
Okay.
Okay. In exam number 2 territory, I'll show you replicas of male and female pelvic structure. I got a handout that goes with that, that makes comparisons. Okay. So go over these things, they're all labeled in the atlas, in the pictures in the atlas. And with the aid of the atlas, you should go over all of this. Now here, there's natural spina bifida. You see there's absence of laminae and a spinous process over here. But since there's no spinal cord, it doesn't cause a problem. So there can be spina bifida down here to a variable degree, but it doesn't cause any neurological problems because there's no spinal cord there. Okay. Then let's take out some of these. Now, it's useful to have the atlas handy. Turn to the page where the disarticulated ribs are shown, and I'll show you what you have to be able to identify. I want to keep this part brief.